Great, very good. Okay, so another area that I think it comes up for many people who have had cancer, and this is not unique to breast cancer, but it's certainly an issue that I hear from our breast cancer patients about, is of course the fear of recurrence. I mean, that's something that is hard not to think about. I have a very dear friend in Boston who's had breast cancer twice, and she's also an oncology social worker, and she wrote a wonderful book called After Breast Cancer and has a whole section devoted to managing uncertainty and fear of recurrence. But I think that's kind of the constant that lives in the shadows, right? That, can I keep this cancer at bay? For many women, cancer came up out of the blue. So, the fear is, how will I continue to stay healthy and make sure that the cancer doesn't come back? But when it's lingering in the shadows there, it's very easy to feel frightened, to feel very much alone, to feel uncertain. And it's not unusual to have cancer-related thoughts. If you read about someone who has died of breast cancer, someone who's gotten more ill, or you go to the treatment centers and you see someone who's particularly sick, it's hard to keep those images at bay. And we may have recurring thoughts that can be really hard to manage over time. It's only been in recent years that we recognize that cancer itself can cause post-traumatic stress. And for anybody who has experienced other traumas prior to cancer, this is just one more. And so we want to try to help people manage that kind of intrusiveness. And some people may find that they have more distress as time goes on. Most people find that as time goes on, without any kind of recurrence of the disease, if side effects are pretty well managed, that distress lessens over time. Now, part of what may happen is that distress may pop back up around visits at the doctor's office, scans, repeat mammographies, things like that. Very normal to have distress come up again, because it's like waiting for the jury to come back. For men, it's their PSA tests. They get that measured and then they wait for the results, and men with prostate cancer. So it's not uncommon to have distress around all these things. The key is, what do we do with it? And it also is impacted by how many side effects are still lingering that affect your daily life. And for some, there are death-related thoughts, which is not all that unusual for people who have had cancer. So one of the things that's important to figure out is, how do we calm down our fear? And fear is a very normal part of the cancer experience at certain points. And with that comes anxiety. Now, what's really important to know about anxiety is that when we're anxious, we typically are either really worried about the future, or we're ruminating and revisiting the past. And the problem with that is both take us out of the moment. Both of it takes us out of the present. And the present is what we have. The present is what we can control. We didn't used to think that the brain could change, but we now understand that we thought after childhood and after attachment in childhood, that was it in terms of brain growth. That isn't true. What we've discovered, and this is largely from working with people who have experienced trauma, that we can actually heal the brain by creating, the brain has all this neuroplasticity. And as we can quiet down anxiety, quiet down trauma, quiet down intrusive thoughts, that actually helps to create what we call neural nets, which is a different part of the brain mechanism that can calm down the amygdala, which is where distress lives. So things that can really help calm the brain down are improved self-awareness, trying to interrupt anxiety, and to be calm. Now, that's easier said than done, but I'll talk about some ways to work on that. And then other things like exercise, diet, sleep, relaxation, Being in nature, we're hearing a lot about that during the pandemic, that being outside can really quiet down our distress. And touch. Now, that's harder if we live alone or we're isolated. But touch is one of those things that can really calm us down, whether it's a hug from a grandchild or getting a massage, and that's harder during the pandemic, of course. But those are things that can be very comforting and reassuring. So, one of the things that we hear a lot about are techniques that can be grounding or meditation. And, not everybody relates to that at all. I've taught some classes on guided imagery and meditation, and there's some people who've taken them that just said, I can't do it. I just can't quiet my brain down. It just doesn't work that way. And that is okay. So, it's finding what works for you. But a couple of quotes that I throw in here are, one is from Thoreau when he lived on Walden Pond. And he actually, interestingly, wrote about being in the moment and said, only the day dawns to which we are awake. And that's really about being present. And then John Kabat-Zinn, who did a lot of work studying meditation at Harvard, and created a technique called mindfulness-based stress reduction, he said, if we wake up to our moments, we will grasp the reality of our lives while we are here. Whoops, that's covered by my slide. What's that other word there? And then he also says, otherwise, whole days, even a whole life, can slip by unnoticed. I was talking to a physician colleague of mine the other day, and she said that one of the things she's already worried about as we come out of the pandemic is her life is getting overly busy again. And that's something she doesn't want. She wants to try to stay more present in the moment so that we can be more awake to our day-to-day moments of joy, of life, and being really present. I know that it's really easy, especially if we're frightened, to be really ruminative about the cancer, or if our lives are really busy, we just stop paying attention to some of the things that are really important. So one of the things that we talk about with mindfulness is, how do we come back to being in the moment? On my team at the Knight Cancer Institute, we have a mindfulness-based stress reduction program that is taught by a woman named Kimberly Carson. If you go to our website, all of these programs are available for free, and they're available online now. And so, you can certainly access that. She does an 8-week training for cancer patients on it's a combination of mindfulness and stress reduction. She also does a weekly drop-in session called Breath by Breath. And again, some of us have meditation practices, and others of us find that that's really tedious. So what it comes down to, according to John Kabat-Zinn, is stopping, being present, and that's all. And so I'd invite you to take several really deep breaths with me right now. Just take a moment. You may want to close your eyes and take a really good deep breath in and a deep breath out. Let's do another one. A good deep breath in and a deep breath out. That can bring you into mindfulness as simply as anything else can. And most meditation and yoga practices focus on the breath. When we are anxious, we breathe very shallowly. We get a push of adrenaline, a push of cortisol. Our heart rates go up, our blood pressure goes up, and it takes us out of the moment. Even if you don't want to try mindfulness or meditation practice, which is just fine, I invite you to several times a day check your breath. I do this on crazy busy weekdays. I'll just stop and I'll close my eyes and I'll take several deep breaths. And that can quiet you down. We also use some guided imagery. So if there's a place, for example, that you particularly love, that calms your spirit, maybe it's at the coast, maybe it's in the mountains, maybe it's a special room in your home, If that's a place that quiets you, I encourage you to get there as much as you can. Or if you can't get there, imagine it or put up photographs of it, and then check your breath. Breathe deeply. At retreats, we do several of these exercises to bring to mind the places that quiet your spirit, that bring you joy, that help you feel much more in the moment. So, ways that you can practice mindfulness are to live in the moment, and be aware of both your thoughts and your feelings. So, some of the folks that have said it's really hard to do a meditation practice find that their thoughts are racing, racing, racing. And that's really a normal occurrence in our daily lives. But that's also true if we're anxious. So just notice what is, and try not to judge whatever those thoughts or feelings are. Maybe today is a hard day. Maybe today is a day where you can't quiet your mind. That's okay. Just take note of that and be curious. I did a session with a group of nurses where we were trying to think about burnout and compassion fatigue and what could help with that. And nurses are pretty stressed these days, as you might imagine. And there was this one session that I did a couple of years ago, and one of the nurses in attendance had told me about a time when she was super burned out. And she had what sounded like one of the worst jobs possible. She had been the administrator of a nursing home that was very understaffed. And she was working about 80 hours a week. She'd put on a lot of weight. She wasn't sleeping. She wasn't eating well. She wasn't practicing good health practices. And one day, she just walked off the job. And, sometimes some of us fantasize about doing that, but rarely do we actually do that. And I asked her what happened after that. And she said she took 6 months off. She really took care of her health. She lost the weight that she put on. She felt much better. And she started a mindfulness practice. And I asked her what that looked like. And it was very simple. It wasn't a meditation practice per se. It was every day she took her dog on the same walk through her neighborhood. But every day she tried to notice something different. And I found after she talked about that, I started doing the same thing. When I take my dog on a walk, I would notice, like today, I noticed how beautiful the fall colors are today. Whereas in the spring, I was noticing the crocuses come up. Those are things that bring you into the moment. Take some deep breaths, focus on beauty, and try to see what comes up. Just be curious. For those of you who are interested in learning more about a mindfulness practice, there are lots of approaches to that. Usually we focus on breath. Again, guided imagery is one. Kimberly, our meditation teacher, does a body scan simply to notice where you're feeling stress. It's often in our shoulders or our neck, or for some it's headaches, for others it's in their tummies. Notice where you're holding your stress and try to breathe into it and try to let go of a little bit of it. You might have a walking or a sitting meditation. There are also a lot of mindfulness apps that are available. Headspace is one, Calm. UCLA has a lot of downloadable free mindfulness apps. One is called Insight Timer. My colleague Karen, who I do these retreats with, said that she could never focus on meditation practices or guided imagery, but she found that Insight Timer really helped her. And so these are apps that you can put on your phone. They're usually 10 minutes long. And if you practice them once or twice a day, it gets easier. It gets much, much easier. And most of us, if we're honest, have 10 minutes a day that we could try to do this on. But it takes practice. I supervised a young woman who was really high strung and had a counseling practice, and she also had a toddler. And as she was trying to learn how to do it, she told me that she'd be 2 minutes in and she'd open her eyes and think, how can this be only 2 minutes? But as time went on, she got better and better at it. And it resulted in her being much more present with her clients, much more present with her toddler, and much happier as a human being. And again, those are some techniques, but other what we call grounding techniques are even, 3 deep breaths 3 times per day. That can be really helpful. And again, as John Kabat-Zinn said, meditation is about stopping, being present, and that's all. So some of the things that we can also do to regain some control and take back some control, especially in those times of anxiety, is to normalize and talk about the fear. That can especially be helped by talking with other cancer survivors or somebody who is safe in your life, who's not going to try to talk you out of being afraid. Sometimes our family members are the ones who are going to be the first to say, oh, that's silly, you'll be fine, think positively, because they don't want us to be afraid. But it's pretty normal to be afraid when you've had cancer. And so being able to just say, sometimes I get scared. May not be all the time, but it may be sometimes. So normalize and talk about it with people who are safe. And then plan for the times when are going to be triggering, such as when you're going for a follow-up scan or tests. Those are probably going to be times that are harder. Some of the people I work with will plan to take their best friend with them. It's harder during COVID again, but plan to go out to lunch after a repeat scan or do something really fun. Begin a worry journal. What we have learned over the years is it's helpful to talk about it, but it's even more helpful to talk and write about it. So sometimes by writing about it, it can help just release it, and it can also help it not have so much control over you. So if you write it down and put it in your worry journal and put your worry journal away, it gives you a way to express it, but then not focus on it. And then examine the automatic thoughts and observe them. Do you automatically go to the worst case scenario? And if that's true, can you then follow with a more hopeful thought? That's some of the work I do with my patients. It's called a cognitive behavioral technique. You may not be able to stop the automatic negative thinking, but you can gradually replace it with things that are a little bit more positive. And also just giving yourself permission to not always be okay. Some days are going to be easier than others. I'm doing a lot of work these days with our healthcare providers who are pretty traumatized by the pandemic. And when people ask me how I am these days, I'm learning to say, today's a good day. And in my work group, we give each other permission to not always be okay. Now that's different than the cancer experience, but what's similar is, there are days that some days are better than others. And then just accepting that, you don't have to be a hero in this. I think it's really important to just accept where you are in the moment and then hold on to the things that give you hope, that bring joy back into your life, and that give you a greater sense of control. I want to talk about depression and anxiety because it's all too common an occurrence for people with cancer. Some people with cancer already have previous experiences with depression and anxiety. And unfortunately, the diagnosis of cancer can also make that worse. About 30% of all people with cancer experience what we've come to describe as distress, meaning, dis-ease and trouble with the whole, diagnosis and whirlwind of treatment and all that you have all gone through. Usually that distress lessens in time, usually doesn't take a lot of intervention, but 10 to 25 people with cancer experience depression, and another 25 people with cancer experience anxiety. And that can certainly intrude in one's quality of life. And so we want to pay attention to that. And we want to try to help people navigate that. For some, it may be going back to the therapist that they saw previously. For others, it may be seeking counseling, for the first time. So symptoms of depression include sadness on most days. And if this persists for longer than about 3 weeks, it may be more than distress. It may be depression. Now, interestingly, what I've observed is for men, it shows up more as anger than sadness. And so when I'm working with men, I ask different kinds of questions about that. But another thing that may indicate depression is apathy or lack of interest in things that normally bring you pleasure, a decrease of interest in the activities of daily life, and for some, decrease in appetite or sleep disturbance, although that's not a great indicator for people who have had cancer because you may already have sleep and appetite disturbances. But the main thing is the inability to experience pleasure, or I forgot to finish the sentence here, inability to enjoy the things that normally bring you pleasure or joy. And so that's a question that I'll ask people if I suspect that they might be depressed, because people who have cancer still usually have an opportunity or an ability to experience joy in a lot of different activities in their lives. And if that has gone away, then it may be worth seeking some additional assistance to help pull one out of depression. Anxiety, on the other hand, can include all that rumination that I talked about, where you're rapidly
You cheap bastard. You couldn't give me some soil?
um, so shortness of breath, difficulty concentrating, sweaty palms, elevated heart rate, sleep challenges, as I mentioned, and rumination, worrying about the past or the future. And again, that takes us entirely out of the moment. So ways to approach this is you may want to seek some help. It's not easy to find therapists these days because so many people have gone back to see them. But the advantage of COVID is you can do this mostly through telehealth. And that can be a really, really important thing. So psychotherapy, medication can be helpful. We sometimes will treat depression with an antidepressant. We often will treat anxiety with an antidepressant because of the neurotransmitters that antidepressant can work on to help calm anxiety. The shorter acting anxiolytics, which are things like benzodiazepines, we try not to use as much these days, but there may be an occasional use for something like trazodone or something else that can help interrupt the anxiety. And I think it's really important to recognize that many, many, many people, not just cancer survivors, but many people in the general population these days are reaching out for psychotherapy and counseling support, as the pandemic has really challenged all of us in this unique time. And the things that usually bring us comfort, our ability to get together, to celebrate holidays, our retreats, support groups, those have become harder, but we're able to do a lot of them virtually. So support groups, even virtually, are really important. I facilitate a support group for the Ovarian Cancer Alliance, and those are often women that have pretty high symptom burden. We have never had such great attendance in our groups since we went virtually. And so that's an advantage. You don't have to leave home. You can still see one another. It's not the same as being in person, but it's something, it's a way of connecting. The peer mentors who are part of the Pink Lemonade program can be a really, really helpful way of connecting. Retreats when they're possible again. One of you mentioned rowing. I love Pink Phoenix and the other rowing groups that are out there. There's one in Vancouver. The walks, the girlfriend walks, again, it's a way of just being together, whether you're talking about cancer or not. And that's sometimes it's that unspoken knowledge that comes from knowing that the people in the room have exactly understand what you've been through, even if you're not talking about it. So something that I think is really, really important to remember is that as human beings, we are inherently resilient. Now, what is resilience? It's the ability to bounce back despite the difficulty. Now, all of us are born with a certain amount of innate resilience, but interestingly, we cultivate more of it over the being exposed to difficulty. So that's a really important thing to know. So as I mentioned, if people in childhood experience a lot of trauma, we used to think that that was sort of defining of them. We now know that's not true. Good therapy, good ways of overcoming the trauma, interrupting the PTSD and the traumatic thoughts can help us develop resilience. It's cultivated by being exposed to difficulty. So, for example, I'm the mental health provider on Oregon's disaster mental health, disaster medical assistance team. During several years ago, when all the hurricanes hit back to back, I was sent to Hurricane Maria with Arizona's disaster team. We were the first team in after Hurricane Maria. So there was no electricity, no water. We landed in the dark. These poor traumatized families were isolated from one another with no way of knowing if their loved ones were safe. And my role was to talk with the people who'd survived this trauma, but also to keep an eye on our first responders who aren't always very good at taking care of themselves. But to a person, the Puerto Rican people that I talked with said to me, "We are resilient people. Please come back during better times." And these are people who have experienced tremendous levels of poverty, numerous natural disasters. And it really made me think again about resilience. And I certainly see it in cancer survivors, that people, despite the difficulty, find a way to somehow get through this. And again, it doesn't come all at once. It doesn't happen the same way for each person. There isn't one right way to do this. But I have been astonished at the resilience that I've observed in the people that I have worked with over these many years. So I ask each of you, what have you discovered about yourself in your cancer journey that has surprised you? What are the things that you want to give up? If we were together doing a retreat in person, we have a ritual on Saturday evening. We usually go Friday evening to Sunday afternoon. The thing that we do on Saturday evenings is we take pieces of paper and we write down on that piece of paper what we want to give up. It may be worry, it may be a toxic relationship, it may be caring about what somebody else thinks about us, any number of things. And we write them down on the piece of paper. We don't tell each other what's on the paper. We wad it up and we throw it in a brass bowl and we go outside and we light those papers on fire and stand in a circle and say goodbye to those things. And we also have to make sure we really are ready to say goodbye, because sometimes we're not entirely ready to give up certain things. But I asked that question: what have you discovered that surprised you about yourself? What do you want to give up? And what do you want to hold on to? So, remembering that you are resilient, you have the ability to recover even when you feel like you don't. And it may take somebody else helping walk with you through this journey to discover that. Focusing on what you have versus what you don't have. And practicing loving kindness. And what that means is give yourself grace, give yourself love, be kind, suspend judgment. We're often so hard on ourselves. And I think it's important to be kind and loving and give yourself grace. And here's where I'm going to invite you to pull out your pieces of paper. And I'm going to walk you through this and have you create some strategies for yourself. At the retreats, we talk about a roadmap that we go home with. This is the thing we do on the last day of the retreat. And I want to invite you to do it now. And after we go through the exercise, I'll have Rachel turn the recording off, and then we can talk about what you've discovered. So these are just examples, but I'd like you to, on your piece of paper, put 4 broad categories. One for physical health, one for psychological health or care, one for spiritual, and one for social. Just do those 4 boxes, if you will. And then what I invite you to do is write down 1 or 2 strategies for yourself that you want to include. moving forward. So under physical health, these are just examples. You don't have to have any of these on here, but these are examples of things you might do to take care of yourself physically. It might be your follow-up medical visits. It might be a commitment to exercising or doing yoga or getting enough sleep or changing your diet. But if you write a specific strategy, you're more likely to follow through. So I'll use myself for an example. If I decide I should lose weight and get more exercise, but I don't have any strategies around that, chances are I'm not going to make any changes. On the other hand, if I say I'm going to go on my treadmill 3 days a week and go for a walk every day, and I'm going to track that, then you're more likely to follow through on that. So take a moment and write down 1 or 2 strategies under physical care that you plan to implement in the next month or 2. And here's where we would have some music in the background. Okay. So next, I invite you into the box that is psychological care. So psychological care, it could be seeing your counselor. It might be finding a counselor. It might be going to your virtual support groups or your other activities that keep you in touch with one another. It might be meditation or journaling. It might be doing art. It might be dancing. But just write down a couple of strategies that make sense to you. And again, strategies that you can follow through with that are very specific and that are doable. That's the other thing. Try to make sure they're doable. If I decide to radically change everything about my life overnight, that's probably not going to be successful. Okay. The other 2 boxes are social health and spiritual or existential care. This relates back to that earlier slide in the beginning of the session about these 4 quadrants of our lives. So who at retreats, I sometimes use the expression, who's your point of light? So for me, that's who are the people I know I can count on? My best friend, my sister, my niece, who are the people I know I can count on? Who are your points of life? Are they your family, your friends? Are they neighbors, your support groups? Who's in your community? And how can you make sure you stay connected with them, particularly during this pandemic time? Some specific things, like maybe you're going to commit to having a virtual coffee with your best girlfriend twice a month. What specific things can you do? And then finally, spiritual or existential care. Again, this is different for each of us. You may have a very specific faith practice that brings you joy and comfort in a faith community. Others, it may be meditation or prayer or journaling. But write down something specific that you want to do, that you want to make sure that you build into your life. And then in these last few slides before we stop recording, just invite you to think about these questions. How has cancer changed you in both difficult and positive ways? What's your intention going forward? What will help you stay on that course? What would you let go of if you could? And who will help you with this commitment? At the retreats, we do this exercise in pairs and then ask people to commit to following up by phone with each other a month later or so to make sure you're staying on the course. So you might want to share your little chart or the answers to these questions with somebody that you're close to who you really trust and ask them to help you stay with this commitment. And the last few slides, I would just say cancer is absolutely a turning point before cancer and after cancer. But it is really important to remember that you are more than your cancer. You are so much more than your cancer. You're this lovely, vibrant human being that has different roles in life, be it sister, mother, child, grandparent, friend. And you're part of this sisterhood you never wanted to be a part of, but you are so much more than the disease itself. And through difficulty there's always possibility to transform. Transformation is defined as a thorough or dramatic change in form or appearance or character. We really understand that cancer has the potential to transform us. And at our retreats, we do collages, which is something you can do at home. All you need is a glue stick, a big chart, like a piece of cardboard, scissors, and some magazines. And the way we do this, and you can do this easily at home, is to create a collage of images and words that just are about transformation. And I always encourage people to let the images choose you so that you just sit down. It can be really therapeutic. It can be really fun. And it'll just maybe help you see where you're going beyond this point. Mary Oliver is a poet whom I love, and she has this beautiful poem that ends with, "Tell me, what is it you plan to do with your one wild and precious life?" Cancer in many ways gives the opportunity to take back our lives and live more fully, more intentionally, and to live right now.